doctor, how are you?
I'm fine, thank you.
Okay, so let's start with the basic question. Many people know about eczema, but maybe not really know what eczema means. So could you help us to understand what eczema and how it affects the skin?
Okay, so eczema is a chronic inflammatory skin disease. So the condition is, I want to emphasize, is a skin problem first. And it's chronic and inflammation because you can get the signs of itchiness, can get dryness of the skin, and then after that, when you are having a lot of itchiness, you start to scratch. So when you scratch, then there'll be more itchiness, and then you scratch some more and more inflammation. So that's why it becomes a very problematic skin disease.
So is it considered an allergy and immune condition or both?
That's a very good question, because I think if I want to put it a very simple way, so eczema, as I said, is a skin problem. But there is a type what we call atopic eczema or allergic eczema. So that can be associated with allergy, for example, food allergy, or in the other package, allergic rhinitis, asthma. So all those are part of the allergy because of the immune system being hypersensitive. So that is an abnormal response. But the skin, because of the inflammation, also involves the immune system. Okay, so it sounds a little bit tricky, but it's actually both. Okay, it's a skin disease with an immune condition. But when the immune system is oversensitive, then we call it atopic eczema, and that could be associated with other allergic problems. Mainly we talk about food allergy, especially in children.
Many parents and adults wonder why me, why my child, and what are the common causes or trigger of eczema?
Yes, so I think when we talk about the causes, we don't really have an exact cause. But we have always thought that genetics is a very important part of the disease, and hence when there's a family history, you're going to be at higher risk. So I think the question about why me, okay, you have to ask the parents because it comes from the genes. But it's of course not just the genes per se, because if you have genes but you might not have the eczema, so it's not all cases that will be like that. But even if there's no family history pun, there can be a likelihood of 15% of getting eczema. But if you are a parent and then you can pass down the genes, one of the parents, then it increases to 20 to 40%. Then if both parents, 50 to 80%. So that's the genetic and the family history. But more importantly now, what I like to emphasize is the environment. So the environment has a major role in influencing that genetics now present itself with eczema. And the big thing is about, to me nowadays, is the climate change, air pollution. So all this environment influences those who are at genetic risk, then you get the eczema.
Okay, doctor, let's talk about symptoms. What are the common signs of eczema?
Okay, so the common signs and symptoms, the most important, the cardinal sign as they call it, or symptom, is the itchiness. We can almost say that if there's no itchiness, it's not eczema. I think of something else. So itchiness is the main symptom, and it's very difficult to treat. And then especially when this itchiness tends to occur, say maybe at night, early morning, 2-3 a.m. when people are sleeping, supposed to be sleeping, either the child or the adult patient will be scratching away and then disturbs the sleep. So the itchiness, and then of course I mentioned earlier, the dryness because of the dehydration, the water loss, because the skin barrier now cannot protect itself from the extra water loss. So when you have, let's say in the scenario in the at night when sleeping, many of us now tend to sleep now with aircon. Now if it's too cold, now the aircon makes it dry, the surrounding air. So now you will get dryness of the skin and actually even more itchiness. So that's why it's important not to have temperature of the aircon below 22 degrees Celsius. So we have the itchiness, the dryness, and then because of that, the skin now becomes, with all the rashes and then the cracked. So that rashes, if you find a place where tak pernah ada, okay, the rashes appearing, for as long as you don't scratch at that area, there won't be any rashes. So that's why sometimes the hint is we say eczema is the itch that rashes. Okay, not the rash that itches. Okay, so if you don't scratch, you don't get newer parts, because that's why you get one part and usually it's the folds lah. So that's the distribution of the rashes. But because you scratch everywhere, and then the whole body can be affected. So now you have dry, cracked, itchy skin, and then of course the inflammation. So you can get it really bad and all red, and then oozing, coming out with secretions, because it's so inflamed and the skin is cracked. All the serum goes through, right? And then when there's all with that crack, then you can get infections. So that's the most common signs and symptoms of eczema.
Okay, doctor, how to know the difference between simple skin irritation and eczema, and that need medication?
So I've gone into quite in depth about the eczema. So quite simply, if it's none of those problems, then you can say it's more likely just a simple skin irritation, because you can ask the patient, and is there itchiness, and it says no, whereas there's quite a bit of rashes. So that's probably just a skin irritation, a direct skin irritant because of contact with chemicals. Or sometimes people forget that actually infections, what we call viral exanthema, can also cause the rashes to come up, and it looks like allergy, but it's not dry, it's not cracked. So all those things will tend to go away quite fast within 24 hours. Whereas eczema is a chronic inflammatory skin disease, so it will carry on. So I think that's why once we know you get the eczema differentiated from normal skin irritation, because skin irritation, once you remove the irritant and you have a simple moisturizer, it just goes away. Whereas you need medicated cream to get rid of the eczema. So you would want to have more of a medical review or medical checkup to be sure, because you think that the skin eczema now becomes infected. Sometimes you can smell bila dia oozing, and then now you start to have a little bit of smell because it's infected, and there could be even pus. So when there's outright pus, then we say that this is time to go and see a doctor, not just to rely just getting antibiotic cream from the pharmacy. And I'm sure they will also advise to see the doctor. So, and then of course when there's sleep disturbance, again I said itchiness is not easy to address, but we can try to give what we call antihistamines to bring down the level of itchiness. But the key thing is good moisturizing, and maybe we will need proper medical advice to see which are the more appropriate moisturizing cream to use.
Okay, doctor, for laboratory perspective, what are the commonly tests that you recommended to people out there?
Okay, so when it comes to laboratory tests, lab tests not everybody needs, because as it is a skin problem. So we know we can diagnose clinically, so you don't even have to have it, right? But majority of patients or the parents or the children will come because they know that, or they wonder what's triggering the eczema to get worse, or what's the cause. So that's where they will always think about allergy. So when you talk about allergy, there are two ways of doing it. Either you do a skin prick test or a blood test, right? But skin prick test is tricky, as far as I know, and to me, I usually don't do it, especially when the eczema is so bad. In fact, we can't do. If the eczema is all over the place, there's no place to even do the skin prick test. And it might make the eczema worse, because just the act of doing the prick, that 1 millimeter deep in your prick, can also cause a reaction, then causing even more misery to the patient. So I think that's just not fair, and in fact I don't think it's right. So it's better to do a blood test. So we just draw out the blood test, and nowadays the technology is so good, 1 ml you can do 100 over allergens, both food allergens and also inhalant allergens.
Okay, doctor, before we're out, any advice would you recommend to people out there to managing eczema?
Okay, so eczema I will unfortunately have to say it again, is a chronic inflammatory skin disease. So the word chronic means it might be years before it goes away. It gets better, it gets worse. It gets better, it gets worse. You go for treatment, you get your medicated cream, antibiotic cream, or even oral antibiotics, and then it seems to all go away. And then suddenly it sort of comes back after, say, 2-3 weeks or a month, and then it frustrates a lot of people. So we have to say at this point of time, there's no cure for eczema yet. Okay, so but it should be, God willing, inshallah, it's manageable, right? And key to this is the constant, regular moisturizing. So you want to use moisturizers that are fragrance-free, preservative-free, that doesn't have much of in the way of perfume. So all these things are now very important to look into when you read the labels. And of course, if you have products that are mainly going to be organic ingredients, that's even better, right? That is certified, that is going to be harmless to the skin that is eczematous. So of course, if you had done the allergy test and you know the food or the inhalants, and the inhalers could also include pets, your cats and dogs. So you got to be careful how you handle the pets as well. So it's a lot of lifestyle thing as well. So we try to do as much as we can so that you will have enough sleep as well. I know it's not easy, but we can manage, and we hope that in due time the eczema will be outgrown. So I think there's a lot of patients, but still the main base line or foundation principle is going to be your moisturizing on a daily basis. Even when things are better, you got to keep on doing it, because you know this is a chronic disease that really actually technically doesn't really go away, because it could be a genetic element as well.
Okay, thank you, Doctor, for your sharing for today. So
You're most welcome.
So to people out there, do your proper testing, and don't forget to watch our next episode.